This term, which is now appearing commonly in the internet, on the news, in social media, and especially in advertisements for medication for depression. The reason that they're coining this phrase is to promote medication products for depression. And the reason why that term came about is because a lot of medications don't work for depression. They fail. They are called treatment, but if you stop taking those medications, the depression comes back. It's not treating the depression, it's managing the depression, it's managing symptoms. And in a symptom-focused milieu, treatment milieu, we're chasing symptoms, we're never ever getting to the cause, we're never really remitting the depression. And so this is where a good marketing phrase comes out: treatment-resistant depression manifests. Well, we know that Prozac and SSRIs and all those lots and lots of medications that are in that category are no better than placebo. We know that now. We know that placebo is within any group, be it a control group or an experimental group. However, the flawed approach that the FDA takes is that they only count placebo in the control group, and they've never asked any pharmacology submittant to refer to the placebo effect within the experimental group, because within that experimental group is another 30% placebo. So that 30% of those participants who are remitting their depression through the actions of allegedly a drug may actually be remitting their depression through the actions of a placebo effect. This is not discerned or required to be discerned by the FDA. And the result of that is that when we poll anyone who is taking an SSRI for depression, and now there have been meta-studies certifying this, is not my word, though in my practice, I am a trauma therapist, I see a lot of depression, and almost everyone coming in, 30% say they're getting relief from those SSRIs, and everyone else says, I take them, but they don't work. So we see that these drugs, through the flawed FDA process, approval process, are no better than placebo. And guess what? Pharmacology is losing money on these drugs. And so now they're hitting us with a new medication approach, disguised as some little guys with a new marketing idea, a new product to help you with your depression, known as ketamine or psilocybin for PTSD. And these drugs are just mass marketing, billions and billions of dollars being spent to mass market these drugs with the idea of treating treatment-resistant depression. As if these drugs are going to actually release depression through serotonin surges in the brain that ketamine creates or psilocybin creates. When energetically we know that depression is expressed in the dorsal vagal, which is in your gut. There are more serotonin receptors there expressing depressive symptoms than in the brain. And I know this because in 8 seconds, I can give someone a Qigong exercise. In 8 seconds, their depression is completely non-existent. And if in 8 seconds we can release depression without any medication at all, we can causally treat the cause of depression. And whenever I ask someone why they're depressed, they know exactly why. And they have good reason to be. We can use a therapy like EMDR to release those causal reasons. And guess what? I have yet to see someone not release their depression in my practice without any medication at all. ever applied. I'm not a prescriber. I can't even prescribe medication. It's not an option. And if we look at something like bipolar depression, here we see a need for mood stabilization that is chemical, that a medication is needed for stabilizing bipolar depression. However, what we often see is a comorbidity with trauma, with childhood trauma and adverse events that are masked by bipolar depression. And so here again, we need a causal model to be applied. And we often see a lot of bipolar depression as misdiagnosed PTSD because of the mood instability. In PTSD, there's a lot of mood instability, and this often gets misdiagnosed. So there's a big miss that happens there. But we can see that in actuality, in reality, there really is no such thing as treatment-resistant depression. This is just a marketing term that is coined in order to sell more drugs that are not indicated to truly remit depression.